We are getting a closer glimpse, a fresher glimpse this morning into just how sick former Vice President Dick Cheney was while he was in office. Jennifer Caudle joins us now to talk more about Cheney's illness. We're looking through some of these revelations, Doctor. Kind of astounding. Trouble walking upstairs. He passed out. He was in incredible pain. It's amazing. I don't think any of us had an idea that he was so terribly sick.
Right. You know, this is actually something that I felt when I read the article, the New York Times article myself, and I think other people have felt as well. You know, the New York Times talks about former Vice President Cheney's sort of struggle with heart disease over the last 35 years, mentioning that he had his first heart attack at the age of 37 years old. Very young. You're absolutely right about that. Eventually suffering 5 heart attacks, having heart failure so severe in 2010 that it's reported that he needed a ventricular assist device. This is a device that can be implanted that helps the heart actually pump, and then finally also receiving a heart transplant. And you're absolutely right. Some of the symptoms that's reported that the former vice president experienced are things like feeling short of breath, trouble walking upstairs, sometimes even feeling, you know, lightheaded and losing consciousness, blacking out at times.
And a nosebleed so bad he had to have emergency surgery.
Right, right. You know, heart disease can be very, very serious. We know that heart disease is one of the #1 killers in this country for men and women. And heart disease can consist of many different conditions. #1, heart attacks, which it seems like the former vice president experienced, as well as heart failure.
You know, as you're reading kind of the revelations coming out in this, and you really do realize how serious, of course it was serious. We always knew his condition was serious, but just how close he was to death. It made me wonder, would someone else be as lucky as him to still be with us today? He has the best doctors in the world, and also he has Secret Service, or he had Secret Service around him at all times watching him.
Right. Yeah, that's a really great question. You know, I don't personally treat former Vice President Cheney, and we don't know all the details about his medical conditions, but you really speak to a good point, right? How severe someone's symptoms are when they have heart attacks, when they have heart failure, certainly depends on a number of variables. #1, how severe they are, but also the medical treatment that they're getting. So that does make a big difference.
And do they pay attention to those symptoms? Because sometimes some of the things we're describing, shortness of breath, disease, you could just think you're having a bad day.
Absolutely. You know? And the signs of heart failure and heart disease can be a little bit confounding. You know, sometimes heart attacks don't always present with chest pain.
Right.
It might be pain in the neck or pain in the jaw or the shoulders or the arms. So it doesn't always have to be those classic symptoms.
But also, it gives us a window into the man also. You know, there's certainly a public service message to why he's doing this, because so many people deal with it. But the details about it was so severe, there was so much risk to the surgeries because of his condition that he literally said goodbye to his family.
Right. You know, it sounds very, very, very severe. You know, I have patients every day that are dealing with heart disease, and one heart attack is enough to literally change the course of someone's life. I have patients that literally are changed people because they've had a heart attack. I can't imagine what it might feel like to have had 5.
And then to have a transplant, too. We should point out that he has written a new book, and he writes it with his cardiologist. But his story, while it seems really miraculous, I think that what you said, Kate, is a very important point. For folks at home, what is the takeaway?
Right.
He had the best care and people by his side at all times, and even watching out for his well-being. Somebody else that might be experiencing trouble may not have access to all of that.
Right, may not have access. I think that's a great point. So a couple take-home messages. I always say to people, if you're worried about your symptoms, then I probably am too as a physician. So, you know, things like chest pain, pain in the neck or jaw, lightheadedness, dizziness, shortness of breath. If you're having symptoms you're just not sure about, chances are I might be worried too, so seek medical care. But there's a lot to talk about prevention here. Let's talk about that, because again, heart disease in this country is so huge, a leading cause of death. First, things you can do. Let's talk about smoking. If you smoke, you need to quit. And if you don't smoke, don't start. Smoking is huge. Quit smoking. It's really important. We talk about the obesity epidemic in this country. Keeping a healthy weight is of utmost importance, and that means exercising too. And watching the diet, a diet that's low in cholesterol and saturated fats, is very important. Limit alcohol intake, but it's really important also to see your doctor and talk about your risk factors for heart disease. It's a really important issue.
When you look at all of those take-home messages that you said, it reminds me of something I learned just a couple weeks ago, is that some 80% of heart disease in women is preventable, and you see that you can take your health in your own hands, and you can actually help yourself.
We bring on a lot of our own problems, and also important to note that in the book, the vice president says that the transplant list that he was on, he didn't get any special treatment. He actually waited longer than the usual wait because he wanted to make sure there was no preference, even though it was a very extreme situation. So it's important to note.
Now we see how extreme it was.
Right, part of the story.
Dr. Jennifer Caudle, thank you. Always a pleasure to have you here talking about a very important topic.
Thanks so much.